Buttocks augmentation is all the rage. Women who don't naturally have a firm round derriere are heading to the operating table to achieve that new look. Joining us to discuss what's behind the trend is Dr. Anthony Nikko. Good morning to you. Thanks for being here. You have seen this procedure be popular for a very long time, haven't you? But it's really trending now.
Right. I started doing this 15 years ago. And back then, people were doing the lift, bottom lift, which left a scar, but that flattens people's butt. So by injecting the butt with the fat and by lift, you give it a lift without the scar and a much better look. Over the past 15 years, it's certainly been increasing in numbers. Back then, I was doing maybe 1 case every other week. Now we could be doing 2 cases a week. And most of my mommy makeovers, I mean, we include Buttock Augmentation.
That's part of it.
Yeah, that's part of it.
And it's not just for women either, is it? Men are doing it too.
Men are doing it too, but the majority are still, our patient populations are the mom who have a couple of kids. They have the stubborn fat in the waistline and they've lost the volume. And by taking that fat from there and creating that very beautiful waistline and adding it into the butt, you give them that lift that they want. And then, you know, we do have certain people who want that really round shape, but the majority of our patients really just enjoy that fullness and that lift that they're looking for.
When you're talking about the injections, so there's no knife involved with
No, there's no knife involved. Basically, it involves liposuction and fat grafting. So you shape the waistline to give them that beautiful small waistline, maybe take a little saddlebags, and then you fill the volume, maybe at the bottom and the side where they lack volume, and give them that perfect shape.
You're just redistributing it.
Yes.
The fact that you're using your own tissue, too, do you find that to be safer as well? Because it's not like your body could never reject it. Right now, we're looking at some pictures. You want to just sort of walk us through and
yeah, as you can see, this is typical of what we see. You can see she has the stubborn fat again on her waistline, and you just sculpt that waistline to come in very nicely, and then you fill in where she needs the volume on top, maybe on the bottom. If she has a little saddlebag, you take that away, and you create that nice curvature, and this is typical of what people are looking for.
Yeah, I know. They're really happy with it. Let's talk about that price tag. Certainly that's a big concern for a lot of people. Yeah,
as you can see on the photograph, what it involves is creating that, making sure the waistline is smooth, so it's liposuction and fat grafting. Typically it starts depending on how much volume you want. If you want to add just a little volume for a lift, it typically starts about $8,000, but some people, you want to go big, go home, bootylicious, you know, a little bit more.
Okay, what about an age range? Are you concerned about that? Are you really looking at how old they are?
Yeah, mainly there's 2 age groups. One younger who wants a little bit more volume in that waistline, but typically our patient population are still the moms in their late 20s, early 30s, who's working out, losing a lot of body fat, but they're also losing the volume from the butt, and the butt's sagging, and they want to look good in the bathing suit. So we take that stubborn fat that they can't work off, and we fill it up, and so most typically it's still the mothers. Yeah.
And then quickly, what about the recovery time?
Yeah. The recovery time is, you know, back then when I was doing implants, recovery time was much longer. But with fat grafting, I mean, you can basically, I mean, you don't have hardly any pain where we inject.
All right. Well, good to know, Dr. Nikko. Thank you for being here and walking us through it all.
Thank you very much.
Popular one. I know more people want to know more about it.
Yeah. Thank you.